Hey there, it's Dr. Jim, and I have a really important question to ask you. You know, I do more than dabble in the world of CBD, I study it intensely. Its application for physical disorders, mental emotional disorders, neurological, neurodegenerative, sleep, so on and so forth, neuropsychiatric. And I am very interested and have been for decades in researching mental health and mental illness. Here's my question for you then. Can CBD combined with antipsychotic medication improve symptoms of schizophrenia? Well, I did the research and I'm happy to report some findings for you. So, many psychiatrists and other healthcare professionals agree that schizophrenia, without a doubt, is one of the most challenging disorders to successfully treat. For one thing, antipsychotic medications usually come with troubling and sometimes dangerous side effects, which make medication compliance or the individual staying on that medication a serious issue. Consequently, starting and stopping these medications can contribute to poor physical health and, at times, a very terrible outcome, earlier death, premature mortality. Because of these concerns and many others, the search for a safer and possibly all-natural treatment that can be taken alongside with antipsychotic medications as well as others is taking place around the globe, and we do need a good solution for this problem. Now, schizophrenia. I'm not going to dive deep into what it is, but I want to talk about the commonly prescribed antipsychotics that are used to treat symptoms, to help better manage symptoms and quality of living. So, in order to gain an appreciation of how CBD can help manage symptoms in combination with antipsychotic drugs, a brief review, bear with me, of schizophrenia and some commonly described antipsychotic medications is provided here. So, schizophrenia, without going into it very deeply, it's a very serious mental illness that affects both cognition, how we think, and our behavior, how we act. People are generally diagnosed between the ages of 16 to 30 years of age. Most likely, they're diagnosed right after their very first psychotic episode. They might end up in an ER, they're seen by a psychiatrist, and there you have it. Psychotic symptoms, what are we talking about? Hallucinations, delusions, and very disordered thought. Some people withdraw completely from others, they lose interest in daily activities, and they have difficulty functioning. So, let's talk about the meds. The first line of treatment for schizophrenia is usually prescribing antipsychotic medications as well as other psychiatric medications like antidepressants, anti-anxiety, mood stabilizers, tranquilizers, sedatives, so on and so forth. The most commonly prescribed, though, and maybe you have heard of some of these, if you watch TV in the evening long enough, you definitely will run into these medications on commercials. Geodon, Risperdal, Seroquel, Zyprexa, Invega, Latuda, Clozaril, Rexulti, and Abilify. I would say those are some of the most commonly prescribed, commercially used antipsychotic medications. There are many other similar medications that are prescribed for schizophrenia, as well as other psychotic disorders. One of the main problems with these medications is the potential for negative side effects. And here are some of the most commonly seen negative side effects. Number one is tardive dyskinesia, or the uncontrolled facial muscle movements. akathisia, or the inability to hold the body still. Parkinsonian-like tremors, not Parkinson's itself, but Parkinsonian-like tremors. Neuroleptic malignant syndrome, and this can be a potentially deadly complication, and people have died and do die because of the complications of the side effects of certain antipsychotics. Now, everybody's different. All of our chemistries are different. Here's some other side effects: cardiovascular problems, serious interactions with other medications, hyperglycemia, which is high blood sugar, hyperlipidemia, high cholesterol, dizziness, sedation, weight gain, constipation, and urinary retention. So, after I read this list, it's pretty easy to see why an individual with schizophrenia may want to stop taking their medication because the meds make them feel worse. Although troubled by their psychotic symptoms, these additional side effects can make the individual feel a lot worse, and therefore discontinue the use of the medication without letting their mental health professional know. And that happens quite a bit. I've been in the world of psychiatry, geropsychiatry, for probably 35 years now, and I've seen a lot, and this is one of those very common behaviors where the individual just gets tired of taking the medication, they don't like how they feel on it, so they just stop, and they don't tell anybody that they've stopped, they relapse, they have some type of mental health crisis, they end up in the ER, and here we go all over again. It's almost like a revolving door. Here is a case for combining CBD with antipsychotic medications. Now, I know that this is like a tiny little niche topic, but there are a lot of people prescribed antipsychotics in the United States and around the world. Actually, it's not that niche. It's a pretty big topic I'm talking about here. According to multiple studies examining the effects of CBD on symptoms of schizophrenia, while subjects were also administered antipsychotic drugs or medications, several findings have emerged. So we're going right to the science, we're going right to the studies, medical studies, academic studies from around the world. McGuire et al., which means McGuire and his other associates, in their article, Cannabidiol, CBD, as an adjunctive therapy in schizophrenia, a multi-center randomized controlled trial. Adjunctive means an add-on med. They report, and this is a quote, the data indicate that 6 weeks of treatment adjunctive to psychiatric medication was associated with significant effects both on positive psychotic symptoms and on the treating clinician's impressions of improvements in cognitive performance. End of quote. They also found that CBD had positive effects on the subject's cognition, the ability to think clearly, so on and so forth, high functional states of mind, especially with motor speed and executive function. Executive function is the ability to plan ahead, calculate, organize thoughts. Okay? Other studies point to the mechanisms of action, and that's something I'm always researching. Mechanisms of action mean the molecules at the molecular level, what is going on with neurotransmitters and neurons and cross-talking between cells. This is where it gets really fascinating. So other studies point to the mechanisms of action that CBD has in the brain of people diagnosed with schizophrenia. First, CBD interacts with serotonin receptors, which helps with mood and anxiety. Serotonin, sleep-wake cycle, good mood, bad mood, up, down. Second, CBD regulates dopamine levels and reduces psychotic symptoms. Dopamine, it's the bliss molecule. Are we Are we seeing reality as it really is, or are we having hallucinations or delusions? Dopamine is also a part of its dysfunction, is a part of Parkinson's disease, so on and so forth. Third, and a well-known feature of CBD, is it reduces neuroinflammation, not just inflammation, neuron, inside cells, which is a biochemical hallmark of schizophrenia. How many of you know, and I only learned this a handful of years ago, that schizophrenia, in part, is caused by neuroinflammation of certain brain cells in certain parts of the brain. Fascinating stuff. Fourth, CBD shows good antioxidant properties. And what does it do? Neutralizes oxidative stress, which protects brain cells. And fifth, CBD has well-known neuroprotectant qualities, which safeguards neuronal integrity and overall brain health. This is really good stuff. I hope you're enjoying it so far. Here are my final comments on this topic. Although in very early stages, research on the use of CBD alongside antipsychotic medication is indeed gaining ground, and with some impressive results. One takeaway for the justification of providing both substances is that they act differently in the body and in the brain. CBD is safe. I think 30 or 40 years now. It has very few to no side effects and is highly tolerable in human studies, in animal studies, but also in human studies. All of this and more make it a prime candidate for treating schizophrenia and other psychotic disorders. So I hope you enjoyed it. The topic was, can CBD combined with antipsychotics improve symptoms of schizophrenia? And my answer is, according to research, yes. If you enjoyed this topic, why not check out my very busy blog, drjimcollins.com, where I write about a whole host of ideas. I'm all over the place, but a lot on CBD. Thank you for watching the video. I appreciate it. And I'd like to introduce you to my book, Living Longer and Stronger with CBD. I had to write this after reading between 500, 550, 600 medical articles written and published all over the world. I had to condense the findings into one easy-to-read book on the health benefits of CBD for physical disorders, for mental, emotional conditions, for neurological and neurodegenerative health problems. I guarantee you, you are going to find this book very helpful for yourself, for friends, colleagues, family members. It's on sale at Amazon.com, but you can check it out at drjimcollins.com. That's drjimcollins.com, or follow the link, okay? So thank you again for your time, and check out Living Longer and Stronger with CBD.